Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, change your brain, change your life, and that's what we've seen.
The information I'm going to share with you tonight is very powerful and very exciting and very important. I spent well over a year writing Preventing Alzheimer's. I wrote it with Rod Schenkel, who's one of the world's authorities. He's a neurologist on Alzheimer's disease, and my task was to provide the imaging. There are many, many images in the book. And also, because this was my 20th book, to make it easy to understand. So that was my major task, was to take what is very complex information and to make it easy. And I think good teachers do that if they know really what they're talking about. So tonight we're going to talk about a very exciting topic, which is preventing, I'm not kidding, preventing Alzheimer's disease. I mean, it was like such a big title. When we delivered this book, we felt like we really delivered on it. This was taken from my balcony at my house. And in the book, we talk about how to keep the golden years golden. I can't tell you how many times I've heard elderly people say the golden years aren't golden. In large part because people haven't been taking care of the organ that makes them who they are. And that's what takes you throughout your life. It's what helps you be effective at work, in your relationships, with your kids, with yourself. You may be at risk for Alzheimer's disease, for dementia, if you have a family member who has any form of dementia, or if they have Parkinson's disease. You may be at risk if you have a personal history of a significant brain injury, of heart disease, strokes, diabetes, cancer, depression. You may be at risk. If you exercise less than 3 times a week, you may be at risk, according to new studies. If you do not engage in regular learning activities, you may be at risk. And if you have a gene called the apolipoprotein E4 gene, having that gene increases your risk 2.5 times for Alzheimer's disease. Having 2 of those genes, because you get 2 sets, one from mom and one from dad, having 2 of those genes increases your risk 5 times. So you may be at risk. With current prevention strategies, you can delay the onset of Alzheimer's disease by 6 years or more. That's really the promise. And the concept is prevention through delay. Because if you can delay it long enough, you'll die of something else. Most of the interventions you'll see tonight are simple. They need to be part of your life early, especially if you're at risk. And regular screening is important for those people who are at risk. Do you know most people with Alzheimer's disease do not get diagnosed until they are in the moderate to severe forms of Alzheimer's disease? Why is that? Because they go to the doctor complaining. my memory's not very good. And because the doctor's working too hard and drinking too much alcohol himself, he goes, that's normal. And doctors frequently blow off significant changes in memory and lifestyle as normal aging. And our feeling, it is not normal for your brain to deteriorate. We have looked at normal brains from 5 to 93. And if you keep your brain healthy as you age, your brain looks beautiful at 73. The most beautiful brain I've ever seen is my mother's brain. I hate to say that, but it's true. 73, she has this amazing brain, but she doesn't smoke. She doesn't drink coffee. She exercises, and she takes care of herself. And it shows. And it also shows in her life, her ability to connect with other people. I mean, it's like 800 friends, you know, at church, on the golf course, wherever she is. And I told her, when I dedicated one of my books to her called Healing the Hardware of the Soul. And as I signed a copy for her with love, I said, you know, Mom, it's not helpful being raised by a woman with a drop-dead normal brain. And she sort of got offended. And she said, what do you mean? I said, well, you're always on time. The house is always clean. Dinner's always amazing. You have 21 grandchildren, and you're like all of their best friends. And I have a difficult father. And I never once heard you yell at my dad. I said, you didn't prepare me to be married. Because I sort of thought everybody was like you. A little bit about us. Amen Clinics, we now have 4 clinics. The newest baby is in Reston, Virginia. It's on track to open in April. We have been a company for 15 years. We've been doing imaging nearly every day for the last 13 years. I'm proud to say we have the world's largest database of brain scans related to behavior. This month we're going over 20,000 scans. So when we look at somebody's brain, we have a good idea what it means. We are doing research and collaboration with the University of California at Irvine. That's where I teach psychiatric residents. We have a project going with the University of Texas on trying to tell the difference between addiction and abuse. Working with Harvard on a project of using brain SPECT imaging in court. We're going to present our findings at the American Psychiatric Association this year. And we just finished a very cool study on meditation with the University of California at San Diego. We actively supervise residents and medical students, and that's the most fun I have, taking the residents. We go to the imaging department. We talk about patients. You know, just last week, a resident had someone on the psychiatry ward who was suicidal, very depressed, and people weren't paying attention to the fact that 2 years earlier he had a very serious car accident. The resident heard my lecture. She took him down and got him a brain scan. He had holes in the back part of his brain that nobody even sort of thought about. I mean, you can't treat brain injury from a psychodynamic perspective only. It's not that helpful. Our work at the clinics is based on 9 very simple principles. I want to go over those with you. And they're very simple. But if you follow the logic, they're very powerful. The first principle is your brain's involved in everything you do. How you think, how you feel, how you act, how well you get along with other people has to do with the moment-by-moment functioning of your brain. After looking at all these scans, I've come to believe that your brain even determines the kind of person you are, the kind of mother that you are, the kind of father that you are, the kind of son or daughter that you are, the kind of judge that you are, or the therapist that you are. You know, say, for example, you have really low activity in your frontal lobes. Well, as a mother, you're going to be late, which is going to increase anxiety in your children. You might say stupid things that hurt people's feelings. And you might go from relationship to relationship. Or say your frontal lobes work way too hard. Well, then you're going to be obsessive, which means things have to be your way or you get really upset. There's this level of rigidity, which can change your whole life. And if you're a judge like that, it's like, things don't go this way, boom, put them in jail for a long time. Without really the forethought of what really could be going on underneath this. So first principle, your brain's involved in everything you do. The second one is equally simple, and that is when your brain works right, you work right. And when your brain doesn't work right, you have trouble being your best self. The images that you're looking on the screen are two SPECT scans. The image on the left is a healthy scan, looking down from the top, full, even, symmetrical activity. The image on the right is a heroin brain. Do you think the heroin addict has any possibility of being that person they really are inside? No. Why? Because they don't have full access to their own brain. Can you judge a person the same way with these brains? A healthy brain and a non-healthy brain. I was just in a death penalty case in Southern California. This man was in prison for murder, and then he murdered his cellmate. And it was clear he's had psychiatric problems since he was little, and he never had any treatment. And when we scanned him, we saw certain areas of his brain that were just fired up. And I looked at the brain and I went, this is usually a brain that gets better with appropriate treatment. And the jury came back with life without the possibility of parole. Why? As they interviewed him, they said, well, you know, we really don't think it's morally right to kill sick people. Now, you can't let them go home, right? I mean, there still has to be some level of responsibility. But if you really understand our work, I mean, it has really vast implications. Your brain works right, you work right. When your brain is troubled, so are you. The third principle is your brain is the most complicated organ in the universe. There is nothing as complex as the human brain. Nothing. It's 3 pounds, about 3 pounds, 2% of your body's weight. Yet it uses 25 to 30% of the calories that you consume. Wow! It is the most active part of your body. Do you ever wonder why people gain weight as they age? Because your brain uses less energy. When you stop learning new things, your brain actually over time becomes quiet. And if you graph normal adults, they become less and less active over time, except those adults who engage in lifelong learning, who are working out what's between their ears. It's critical. You want to keep your brain healthy as you age, you have to learn new things. It's estimated your brain has 100 billion nerve cells, and each nerve cell is connected to other nerve cells by up to, according to Dr. Schenkel, 40,000 individual connections, which if you do the math means you have more connections in your brain than there are stars in the universe. Your brain is incredibly complicated, and it makes you who you are. Now, if you believe these first three, this next one is critical, and people discount it. The next principle is your brain is very soft. Your brain is about the consistency of soft butter. Some neurosurgeons think it's really more like a raw egg. And it is housed in a really hard skull. And the skull has ridges, sharp ridges, especially the ridges that surround your temporal lobes, the part of the brain that is heavily involved in memory. So if you believe what I'm telling you, that your brain's involved in everything you do, and when it works right, you work right, and that it's complicated and soft, housed in a hard skull, why in God's name would you ever let a child hit a soccer ball with their head? Why would you encourage them to play tackle football? Why would you let them go up to the mountains and snowboard without helmets? We have no clue the risk that we put people under, and probably the single most important thing I've learned doing 20,000 scans is that minor traumatic brain injuries changes whole people's lives, and nobody knows about it. Because basically, if you have bad behavior, people think that's a choice on your part, and they never look at the reasons why. Mild traumatic brain injuries. Sometimes even injuries where you don't hit your head. How can that happen? Well, what if you take a baby and you shake them? Well, what's going on inside their skull? Their brain is bouncing back and forth. Or if you get rear-ended by a car going 35 miles an hour, what is happening to the forces inside your skull? And loss of consciousness has nothing to do with how severe the brain injury is. Because consciousness is a brainstem phenomenon. You might really hurt the cortical surface, the part we use to think, and have never lost consciousness. A little scary. The next principle, again, really simple, and you'll find this in most neuropsychiatric or neuropsychological textbooks, is that certain parts of your brain do certain things. I mean, we know, for example, that the PFC, or the prefrontal cortex, is the executive part of the brain. It's involved in things like forethought and judgment, impulse control, organization, planning. The temporal lobes are involved with memory, mood stability, temper control, reading, listening. The parietal lobes, the top back part of your brain, are involved with creating and reading maps. They're involved with direction sense. One of the first areas to be low in Alzheimer's disease, which is why people with Alzheimer's disease have trouble getting from here to there. They get lost, even in places where they've lived for 30 years. The occipital lobes are involved in vision. The cerebellum is involved in motor coordination. But now what we know, it's also involved in thought coordination, how quickly you can integrate new information. And in our research, we found that it's low in ADD, and it's low in autistic spectrum disorders. It's low in brain injury. It's going to be a very important part of what we do. But this principle is very simple. Certain parts of your brain do certain things. The next one, equally simple, that problems in certain parts of your brain, like your parietal lobe or your temporal lobe, tend to cause specific problems. So if you have problems in your parietal lobes, you're going to tend to get lost. If you have problems on the inside of your temporal lobes, you're going to have memory problems. If you have problems in your frontal lobes, you're going to have issues with judgment, with attention, with impulse control and organization. The next principle is a little bit more controversial. It's clearly true. Most psychiatric illnesses, including dementia, are not single or simple disorders. Depression is not one thing. Depression is at least 7 different things. ADD is not one thing. I saw a boy today diagnosed with ADD as a child, was put on a number of different medications. One of them made him want to kill himself. Another one made him want to kill his mother. And that's where imaging is really helpful, because it helps you identify what types. Depression is a symptom. When you give somebody the diagnosis of depression, it's sort of like giving them the diagnosis of chest pain. And why don't we give people the diagnosis of chest pain? Because there are lots of reasons for it, right? I mean, you can have chest pain if you're in grief, so from your head. You can have chest pain if your thyroid gland works too hard. You can have chest pain with a heart attack, or with pneumonia, or if you have kidney stones, or if somebody hits you really hard in your chest and you have a bruised rib cage. There's lots of different reasons. What we find is depression is the same way. It's important to understand where it's coming from. So most psychiatric illnesses are not single or simple disorders. The next one, the one we live by, is that imaging the brain, looking at what you do before you do it, helps you be more effective. The other thing it does is it increases compliance. People see that they have a medical problem, and it decreases stigma. They don't feel guilty about it. They feel more motivated to go get it fixed. Which is very important, because many people do not go and see a psychiatrist or seek help for psychiatric problems because they feel shamed. Because if only I was a better dad, my child wouldn't have a problem. Or if only I was a better woman, I wouldn't feel depressed. When if you look at the statistics, 49% of the U.S. population, this is an NIH study, 49% of the U.S. population at some point in their life will have a diagnosable psychiatric illness. It is almost more normal to have a problem than to not have a problem. Yet millions and millions of people in the United States and around the world are ashamed that they feel sad or suicidal or they can't go to work because they are so racked with anxiety. No wonder there's so much denial. The last principle, the one that is more exciting than anything else nearly in my whole life, is that your brain can change. You are not stuck with the brain you're born with. You can do things to enhance it. Now, sometimes when we do things, we make it worse. I mean, we see some kids who are on 7 different medications. I just treated one man who was diagnosed with bipolar disorder. He came to me with 7 different medications. And his boss said he was going to fire him because he was slow. And I looked at his scan, and the medicines were clearly toxic for him. But how would you know if you didn't look? I mean, the other exciting thing, on the positive side, is if you see what's going on, as in this scan on the left, we see overall decreased activity, is with the right treatment, you can enhance brain function. How exciting is that? That you can balance the brain. But you have to look. You have to know what you're working with. Now, if you believe these sort of 9 principles, then why, help me with this, why are psychiatrists the only medical specialists that never look at the organ they treat? I mean, you can try and kill yourself today in Seattle, and virtually no one outside of our little clinic in Tacoma will look at your brain. You can try and kill yourself in Los Angeles, and virtually nobody will look at the brain. You can kill 6 people in Washington, D.C., and virtually nobody will look at the brain. And if you don't do that, then it's easy to put those people to death. It's easy to kill yourself because you think, I'm just a bad person. So you don't really see it as a medical problem. Well, some of the reasons that psychiatrists don't look is that imaging is not part of our training. It's not part of our experience. The University of California at Irvine is the only residency program I know of in the world that teaches their residents how to apply imaging in day-to-day clinical practice. Most psychiatrists have no clue how to look at the scans. And most psychiatrists think that the problems have to be this obvious before they think about brain dysfunction. Some of you may have seen this picture in the paper. This was a repairman who was up on a ladder, who was working with a long drill bit, trying to fix something. And there was an accident, and he fell onto the drill bit. And the drill bit went through his right eye and pushed his brain to the side and went out the back of his skull. And he lived. Can you imagine if you're this guy and you stand up and you go by a mirror? I mean, what would the first thought in your head be? Or if you're the doctor in the emergency room and the guy walks in, what would you say to yourself? Well, they got a neurosurgeon, and the neurosurgeon starts playing with this thing, and he actually unscrewed it. Now, I think that's a little bold because you could rip an artery or rip a vein, but he lived. Isn't that amazing? But most mental health professionals think that your brain problems have to be this clear before they think about looking. It's time to change. The brain is our organ. There are literally thousands of articles. I mean, it's so exciting these days. I mean, I've been doing this for a long time. But if you open up the American Journal of Psychiatry, 30 to 50% of those articles will be brain imaging articles. If you open up the Journal of Neuropsychiatry and Clinical Neuroscience, 60 to 70% are brain imaging articles. And so when people, criticize my work and they go, oh, there's no science behind it, Ron Schneider, our webmaster, and I, we put on the web, I think now it's about 1,250 scientific abstracts on brain SPECT imaging in psychiatry. So you don't believe it, my next question is, can you read? All right. So why do we look? Well, we look to increase compliance. The first patient I ever scanned in 1991, she had ADD. I knew she had ADD, but she didn't think she did, and she wasn't even going to look at it. I said, well, can we at least look at your brain? And she said, okay. And we scanned her at rest. The image at the left is rest. We scanned her with concentration. And what we saw with concentration is her brain dramatically shut off. And she looked at me and she said, Dr. Amen, you mean that's not my fault? Bingo. That's right. Having ADD isn't a choice. And having ADD, the harder you try, the worse it gets. And we believe having ADD increases your risk for Alzheimer's disease. Why? Because it increases chronic stress. Having untreated ADD, chronic stressful existence. Also increases your risk for brain injuries. Did you know, according to a brand new study from the Mayo Clinic, children who have ADD use medical services twice as much as other people? Not psychiatric services, just regular medical services, because they get into accidents more often than other people. So seeing the scans, go, oh, I can see I have a problem. Help me fix it. They also decrease stigma. They decrease the shame. This is a man who had paranoid schizophrenia, who didn't want to be treated. But he saw a scan and he went, can you help this? I mean, that's often their first. And you know, people's biggest worry when they come to our clinic, their biggest worry is not that they're going to have a brain tumor. It's that their scan will be normal. That is their biggest worry, because they want to understand why they're suffering. We scan people because it adds really important information. This is a girl that came to see me from Anchorage, Alaska. When she was 17 months old, I saw her when she was 17, but when she was a baby, her parents were building a house, and they had doors hung up around the house, but they hadn't been, doors leaning up against the wall, they hadn't been hung. Well, she put her hand in one of the holes where the doorknob was going to be and pulled it onto herself and cracked her skull. She did not lose consciousness, but she basically performed a prefrontal lobotomy on herself, wiped out her frontal lobes. I mean, they're dead. Now, why is that important for us to know? She has no executive function. She has no impulse control. She's a beautiful girl, and so guys hit on her, and she goes with them because she has no judgment. She lives in Anchorage, Alaska. She wants to feed the birds. 3 hours in the middle of winter outside feeding the birds, so she got frostbite. And what the scan tells us is, one, she's not getting executive function, because this is not a scan we can fix. But what it tells us is the parents have to provide a guardian for her because she won't have proper executive function. They cannot leave the family fortune to her. That's very important to know that, to plan to help protect her. One of the reasons I really like these scans is they help decrease denial. It's really hard to be a substance abuser. Substance abuse increases your risk for Alzheimer's disease. It's really hard to be in denial when you look at your scan and it's filled with holes. It looks like a shotgun went through it. It's really hard to be in denial. And so some of you have seen our poster, Which Brain Do You Want?, which is a healthy brain surrounded by young drug-abusing brains. That poster now hangs in over 10,000 schools around the world. And it increases discussion about it. I did a show with Lisa Gibbons called The Truth About Drinking. And in 1999, it won the Emmy for Best Educational Television. And my job was to take a 22-year-old, scan him. He was an alcoholic. His brain already looked like it was about 70. And then on national TV, we got him drunk. And then we scanned him. And we found, why do people act badly when they drink? Because it drops activity in their frontal lobe. So they have no judgments. They just say the first thing that comes to their mind. Now, you can see why people drink, because often they have very hot brains, and they drink to settle them down. But it helps us see toxicity. Toxicity sometimes can be from self-inflicted toxicity, too much wine, or it could be from working in a toxic environment, like working in a furniture factory, or some of the mills, I would imagine, with all the chemicals that are being used, are clearly not good. Or if you're an indoor painter, the fumes that you get exposed to, or if you're working in a dry cleaning shop, even if you're working in an acrylic nail shop, you're exposed to these solvents, if you will, and you know the brain is 60% fat. So you don't want to be around a lot of solvents that dissolve fat. Often we see unexpected findings. This is a woman who thought she had ADD, saw 5 different psychiatrists in the Bay Area, San Francisco Bay Area. Every ADD medicine known to God and man she had tried, it didn't work, and so she went and saw an ADD coach. The coach said, you know, maybe you have something different than ADD. You should go see Dr. Amen. And when we scanned her, what we found is she had a tumor in her cerebellum the size of a lemon. Now, I have to tell you, over the last 13 years, we've found strokes, we've found tumors, we've found cysts. I mean, we found all sorts of things that we didn't expect, and she couldn't get better. Ritalin does not fix tumors. We scan people to see who may be at risk for dementia. We believe, and studies will support, the fact that you can see who's vulnerable to Alzheimer's disease 5 to 7 years before they have symptoms. Now, why is that important? Because you can do prevention stuff. You can do early treatment. The earlier you diagnose it, the less tissue is damaged that you can rescue and save. So if you have it in your family, getting scanned about 50 is probably a good idea to see how's your brain doing, because the scans are very consistent over time. We'll talk a lot more about that. We use the imaging to target treatments. This is a person who was arrested for felony domestic violence. He had a diving accident. If you look at the image on the left, the top is the front part is really low in activity. That's where the holes are. And his temporal lobes, right about in the middle, are dramatically underactive. He had a diving accident. So we knew we had to target his temporal lobes and then target his frontal lobes. And the scan on the right is his brain 3 years later. We're like pretty excited. In fact, you know, with all these makeover shows, I'm thinking of doing a makeover show. We'll call it Extreme Makeover Brain Edition. I'm not kidding. I think this stuff is so exciting. We have to teach people that their brain matters. The next thing we do a lot of follow-up scans. And why do we do follow-up scans? Because we want to see how we're doing. You know, this is a very beautiful, sweet girl who has ADD. Overall underactivity. This is on 1 dose of 15 milligrams of Ritalin. The next night, much better activity. I mean, we're celebrating. Why? Because she's going to go from B's and C's to all A's with dramatically less effort. Do you think leaving her, see, if you never scan her, what she does is all of her life she thinks she's stupid. And she underachieves for her ability. So she's more vulnerable to anxiety, more vulnerable to depression, more vulnerable to relationship problems because she doesn't have a good sense of herself. You want people that you love to have the best brain function possible. You also want the people you hate to have better brain function so they won't be so irritating to you. We scan people to prevent mistakes. Often, we see these very active brains. And these are little kids that come in with ADD. And we go, oh, they just have ADD. And we put them on stimulants, and 7 times out of 10, they get worse on stimulants. Well, wouldn't you want to know that ahead of time? So it helps us prevent mistakes. It also saves money. Now, I know imaging can be expensive, and some insurance companies cover it, and some don't. But we have to ask ourselves, what does it cost to have an ineffectively treated psychiatric disorder? It's huge. I mean, from losing your job to getting divorced to not being able to do school and so on. If we think about the money that we spend going out to dinner or on beer or whatever, and the money we do spend on our kids, this is really quite a cost savings. One study done in 1992, presented at the American Psychiatric Association, where they looked at bipolar teenagers. 50 of them they scanned on the day of admission. 50 of them they never scanned. And they looked at length of stay. And the average length of stay for the kids who were not scanned was 44 days. The average length of stay for the kids who were scanned was 17 days. It was an average cost savings of $15,000 per hospitalization. And that's my experience. Since I started imaging, I hospitalized 90% fewer people. Why? Well, one, I was more confident in what was going on. Two, the family was more compliant. And three, I had the plan in my head on we're going to do this, and then we're going to do that, and then we're going to do this. And you got everybody on board. And so it made it easier. And rather, you get somebody and they have suicidal thoughts, rather than there's no hope, you look at the pictures, there's hope. Right? I mean, that's probably the most, that's why our phone number in Tacoma is 253-779-HOPE. I love that, because that's probably the single most important thing we do. And I often, when I sit with the patient, I look at them and I'll show them their scan and I'll go, you have a great brain. It's just not working hard enough. And we can help that. Or you have a great brain, but the whole thing is hot. We have to settle it down. Because we don't want anybody to go away feeling damaged or shamed. We want them to have hope. And these things do that. One of the most fun things I do is we study treatment effects. We just finished a study on meditation. We've done studies on medication. We just finished a fabulous study on a psychotherapy called EMDR. It stands for Eye Movement Desensitization and Reprocessing. And we got just stunning results. EMDR only worked better than Prozac. That's pretty exciting. If you don't know how to do EMDR and you're a therapist, you should check it out, because there are not that many side effects with EMDR. People don't have sexual side effects like they do with Prozac, Paxil, Zoloft, Celexa, Lexapro, and so on. So EMDR is very cool. We also look at supplements. I'm a huge believer in supplements, but you need to know the right supplement for the right type. You can't get your supplement information from the 17-year-old clerk at Walmart. But that's how a lot of people do, and sometimes St. John's wort really helps, and sometimes it'll make you suicidal. And so you want to know what supplement for what brain pattern. And we just finished a little study with chocolate and almond extract called Solite. And I'm thinking to myself, Hershey bars, Hershey's with almonds. And what we found is it worked almost like Prozac. It made you happy and stupid. Just one scan. I mean, to look at before and after, the image on the left is a 26-year-old woman who had just moved and got into a very severe depression. And on Prozac, 6 months later, it's her scan on the right. And so you put them in front and you go, I mean, my first thought with this woman is, you need to go put your head under cold water. Just calm it down. But it gave her an idea why she was that way. And also gave her fiancé an idea that, this is not her. This is her brain fired up. And on treatment, just so much better. When we do imaging, we do a study called brain SPECT imaging. SPECT stands for Single Photon Emission Computed Tomography. It's a long phrase that means we take isotopes, combine them with substances that are easily taken up by cells in the brain. We use isotopes as tracking devices through a little tiny butterfly needle. We put a needle in your arm and inject the medicine, and it goes up and lights up your brain and produces millions and millions of photons that we can measure with our gamma camera. And so the images that I show you are all made up of about 10 million counts, or times the photons, think of them like little pieces of light, hit the crystals. I think it actually provides a window into your soul. The book Healing the Hardware of the Soul is, who you are inside. That part of you that's only known by you and God has a lot to do with brain function. And some people will do what is really dark, evil, awful things. And it's not because they want to do that. It's because something's the matter in their brain. So, a window into the soul. These are really easy to understand. Keep it simple in your head because we look for three things. Areas of your brain that work well, areas of your brain that are underactive, and areas of your brain that are overactive. And that's it. Good activity, too little and too much. And if you have too little, we want to raise it, whichever way we can do it. Whether it's hyperbaric oxygen treatment, whether it's medications or supplements or new treatment called transcranial magnetic stimulation, or treatment I like a lot called the interactive metronome, where we're really working to stimulate the cerebellum. Or if we need to calm it down, and we can calm it down with medicine, with some supplements, EMDR, certain forms of psychotherapy tend to calm the brain down. So we're looking for balance. These are the different indications, the clinical indications that we order it for. And the first four are approved indications by the Society of Nuclear Medicine. So for brain trauma, cognitive decline, what we're talking about tonight, blood vessel disease in the brain, and epilepsy, standard indications. So people go, oh, so controversial. It's like what? Medicare will frequently pay for it. Now, we've added the last four because with our experience we find this extraordinarily helpful with aggressive behavior, with suicide, with toxic exposure. We like to subtype different diseases. What kind of ADD do you have? Do you have a hot brain or do you have a cold brain? And if you're resistant, if things aren't working the way we think they should work, that's when we order them. Looking at a healthy brain, again, the image on the left is looking down from the top. The image on the right is looking up from the bottom. Full, even, symmetrical activity. Now stay with me on this point, because how we make these pictures is we set a certain threshold in the brain. And what we do is we look at the top 45% of brain activity. Anything below that is 2 standard deviations below normal. So when you see the holes, they're not no activity. What they mean is low activity. Now sometimes if we don't know, we'll actually drop that threshold, add more counts, and if we still see the hole, then we send you for an MRI because you might have a tumor, or you might have had a stroke, or you might have a cyst, and so on. So this lets us see the underactive areas of the brain. Here, we're looking at the hot spots in the brain, where blue is average activity and red's the top 15%. And one is looking up from the bottom, the other down from the top. And what we see is the most active areas in the brain, in humans, is the cerebellum. Why? Because the cerebellum actually means little brain, back bottom part of your brain, 10% of the volume of your brain, yet it has 50% of the brain's neurons. So no wonder it's so active. So the reason that you shouldn't smoke, smoking is the #1 cause of strokes worldwide. Strokes where a blood vessel breaks, where blood clot goes and chokes off blood supply to an area. Strokes put you at risk for Alzheimer's disease. Of course, if it's like knocking out your temporal lobe, that could be a real problem. This is the classic Alzheimer's picture. Bilateral decreased parietal lobe activity, bilateral decreased temporal lobe activity. You'll notice underneath it says, should we scan presidential candidates? I just wrote an op-ed piece for the New York Times. That was the title of it. You bet we should scan them. A president with a bad brain can cost millions of people, maybe even billions of people, their lives. And 2 out of the last 5 presidents have had significant brain problems. President Reagan had Alzheimer's disease in the White House. We know Alzheimer's disease starts 20 to 50 years before you actually have symptoms, that we can see the beta amyloid plaque formation starting, which are one of the mechanisms of Alzheimer's disease. And it was clear when he said he didn't remember the Iran-Contra affair. I totally believe him. He forgot! And I don't know what you think about President Clinton here in Washington, but He had frontal lobe problems. I mean, let's think about it. Bad judgment, not learning from the mistakes that you make, excitement-seeking behavior from the Oval Office while you're on the phone with members of Congress. What do we call this? Executive dysfunction. No kidding. And we have suffered a long time because of his indiscretion. We're still suffering. Monica Lewinsky got her own talk show. I mean, let's think about leaders with bad brains. Milosevic. Both of his parents were alcoholics. Both of his parents killed themselves. He had problems with alcohol and depression. You think he had a normal brain? No, bright, intelligent man. Cost millions of people their lives. What about Saddam Hussein? I mean, do you know about Saddam's history? His father died when his mother was pregnant with him. His mother had psychotic depressions. She tried to kill herself. Saddam was raised by family members for the first 3 years. And when he finally went back to his mother at the age of 3, he was newly married to a man who psychologically and physically abused him. He didn't care about anybody else. We call it malignant narcissism. Why? Because his brain had been traumatized. There's not good brain development. If you don't have good brain development, you don't have empathy. And empathy is very important, but empathy comes from bonding. It comes from connectedness, and it comes from your brain connecting itself properly at a very early age. You bet we should scan presidential candidates. So this fall, we should see a picture of President Bush and a picture of his scan. And we could find out how much alcohol and cocaine he did. And maybe that's why he mixes up his words a lot. And misinterpreted the information on Iraq he got from the CIA. And then, you know, we could see, although this isn't going to happen, although it's more fun to talk about, Howard Dean, you know, the doctor, and a picture of his scan, and we could find out about his temper and why he likes screams and stuff. Right? We call it cingulate gyrus problems. Can't let go. Head injuries, wear your helmet and stay off the roof. These are 3 serious head injuries that had no loss of consciousness. The image on the left is a bike accident, the damage to the front and the back. The image in the middle is a football accident, just wiped out his left prefrontal cortex, bottom right. And the image on the right was a college student who was walking in the rain to class, and she slipped and slid down a metal ramp 20 feet head first into a metal pole. No loss of consciousness, but she couldn't do school. And people would call her faking. John and I are working on a case. And, you know, somebody has a severe brain injury. The opposing attorney will send them, they'll find a neuropsychologist to go, malingering, faking. And we do the scans, and they have this big dent in their frontal lobes. I have an attorney that I work with in Southern California, and he was in a car accident, actually bent the frame of his BMW. And the insurance company basically sent him to a couple of neuropsychologists who said, he's malingering. He's going from $1 million practice to the disability policy is like $80,000 a year, and he's malingering. And the jury gave him $1.8 million. Why? Because they were furious that they had traumatized this man twice. Traumatized one by losing function and not being himself. Traumatized the second time by calling him a liar. By calling him a faker, a malingerer. It's not nice. I mean, the imaging really helps to see whether or not brain trauma is there. The real reasons you shouldn't use drugs, they damage your brain. I mean, I don't know how to get clearer than that. They limit your access to yourself. If you look at cocaine and methamphetamines, not that nice. So it's why it puts you at risk for cognitive problems as you age. Alcohol, and you go, Dr. Amen, I read all the studies that alcohol is good for your heart. A little bit of alcohol is good for your heart. New study from Johns Hopkins, a little bit of alcohol also shrinks your brain. So yes, you may live longer, but you won't be that smart. Heroin is not that good for your brain. But you know what? Vicodin does the same thing. OxyContin does the same thing. Anybody besides me can make this connection with Rush Limbaugh when he got fired from ESPN because he made stupid comments about the Philadelphia Eagles quarterback? And within like 2 days later, he's being investigated for like getting extra OxyContin. I went, it's brain damage. That's why he says stupid things. Now, I don't know how long that brain damage has been going on because he's said stupid things for a long time. I write a weekly newsletter, and you're all welcome to get it for free. If you go to amenclinic.com, you can sign up for it. It's called Brain in the News. So I write about the brain as it has been in the news that week. Like this past week, I wrote about bat venom. Bat venom has a special protein in it that keeps blood from clotting. So when a bat bites you, they inject the protein to keep the blood flowing so they can feed. Well, they also found that's helpful for strokes. Helps to dissolve the plaques quicker than other things that we have. So I wrote about that. And I wrote about the neurosurgeon who separated the baby that was born with a head on top of its head, baby with two heads. It was the baby's twin that was attached at the head. The rest of the baby didn't develop. Well, that neurosurgeon is the same one, Jorge Lazareff, who when my nephew was violent and we found a cyst in his left temporal lobe, it's a neurosurgeon who took me seriously enough to take it out and save my nephew's life. I'm so excited. He's also the neurosurgeon who separated the Guatemalan twins. I mean, one of my heroes. All right, age-related memory problems. These are a list of them. Alzheimer's disease, frontal temporal dementia, vascular dementia, something called Lewy body dementia that's associated with Parkinson's disease, alcohol-related dementia, chronic fatigue syndrome significantly increases your risk for dementia. And many people with chronic fatigue syndrome have dementia. Mild cognitive impairment, that's where you're on your way to Alzheimer's disease and brain trauma. So if we just look at them, now if we want to define dementia, what it means is damage to nerve cells that results in a progressive difficulty with remembering, thinking, or doing your usual activity. So when we talk about dementia, it doesn't have to be somebody who's 85. It can be somebody after an accident who is 29 will meet the criteria for dementia. Alzheimer's disease, typically bilateral, both sides, decreased activity in their parietal lobes and their temporal lobes. One of the new findings is there's an area in the brain, deep in the parietal lobes, called the posterior cingulate gyrus. It's an area that gets information from the medial temporal lobes, the inside of your temporal lobes, out into long-term memory storage areas in the brain. And when that's low, it's one of the first predictive signs of Alzheimer's disease. We can see that on scans. The mechanism for Alzheimer's disease tends to be two things. One, it's the deposition or the deposits of things called beta amyloid plaques. Now we all have, they almost look like aging spots in the brain, and we all get them as we age. These are virulent. I mean, they're really awful. Toxic, that go in and basically short-circuit nerve pathways. So the more beta amyloid plaques that you have, the more likely you are to have Alzheimer's disease. That's why you shouldn't take Tylenol, acetaminophen, because acetaminophen actually increases your risk for Alzheimer's disease significantly. We think because it affects the liver and it decreases the production of an antioxidant, a super antioxidant called glutathione. And you probably should take low doses of ibuprofen or Aleve because they've been found to decrease the deposition of beta amyloid plaques. And people who take low-dose non-steroidal anti-inflammatories, especially Aleve and ibuprofen, they have Alzheimer's disease 2.5 years later than other people. So it delays the onset of Alzheimer's disease. So you bet I take my little Aleve every morning. That also helps because, you know, as you sort of get close to 50, right? Things hurt a little bit more. Now, you don't want to take high dose because they can be toxic to your kidneys, or they can cause abdominal bleeding. You have to sort of find what's the right dose for you. There's another condition called frontal temporal lobe dementia. That's where the frontal lobes and temporal lobes are starting to deteriorate. Now, this typically presents with executive dysfunction, so judgment problems, problems with energy, problems with motivation. The image on the right is a friend of mine who, she was alive and bubbly and sweet and sort of the matriarch of her wonderful family until she turned 62. And then she just stopped caring. She watched TV all day long, and this wasn't her. See, you get concerned when it is a change in behavior. It wasn't her. And when we scanned her, we saw her frontal lobes beginning to deteriorate. Unfortunately, that's not one we have very many good treatments for. Alzheimer's disease, there's lots of good things to do. There's another one called vascular dementia, where if you have a stroke, now sometimes the strokes are only the size of a pencil head. I mean, really tiny strokes. If they're in the wrong part of your brain, they can cause massive destruction, especially in the deep areas of the brain, in the basal ganglia and the areas surrounding them. Sometimes you have large strokes. And if you have a large stroke, it increases your risk for depression. If it's on the left side, you have a 60% chance of developing major depression within a year. If it's on the right side, you often are in denial that you have any problem. So if you're going to have one on the right side. I mean, if you have a choice. Something called Lewy body dementia. It's dementia that looks very much like Alzheimer's disease. It's often associated with Parkinson's disease. And what we see are these depositions of these certain protein plaques that go to the basal ganglia, one of the reasons we think they have Parkinson's disease, and go to the occipital lobes. And Lewy body dementia is often first seen when somebody has visual hallucinations, because it goes to the visual cortex of the brain. So somebody who's 60 who has new onset visual hallucinations, somebody should really screen them for this disease. So it's the one that's associated with Parkinson's disease. Alcohol-related dementia. Alcohol is not that great for you, and if you drink a lot, you're really going to have significant problems over time. Some people think this is the second most common cause of dementia in the United States. Chronic fatigue syndrome, which is due more than likely or not to a virus. When you look at the brains, it used to be chronic fatigue syndrome was thought of as these are crazy people. These are histrionic women, or these are men that have personality disorders. Until you look at their brains, I'm a total believer that this is a virus that severely affects brain function. Mild cognitive impairment. What is that? That is where you're beginning to lose your keys. You're beginning to you go into a room and you go, okay, why am I here? Or you go out into the parking lot and you go, I think I drove. It's the early stages that most people will blow off. So you're beginning to complain, but most people are saying it's normal. It may not be normal. At that point, it's critical to get screened. One way to get screened is imaging. Another way to get screened, and you should all write this website down, mccare.com. mccare.com has an inexpensive screening tool that you can take online. Now, you have to have somebody give it to you, but your husband can give it to you, or your mother can give it to you. If you're concerned at all about memory, it's a really good thing to take because it is very sensitive and very specific. Brain injury. Can anybody see why this would increase your risk for like frontal lobe dementia? This is somebody who actually fell on the back of their head and broke the occipital bone in the back of their head. Well, if you look at the scan, you see their frontal lobe toward the top severely damaged. This is what we call a coup contra coup injury, where the primary brain injury is on the opposite side of where it occurred. And this is a person who had very severe brain injury, subsequently dementia. Okay, you want to prevent Alzheimer's disease? These are the steps. The first thing, know what your risk is. Keep your body and your brain active. Antioxidants, crucial. Beta amyloid reducing agents, we just talked about that. Ibuprofen is one of those. Modulate glutamate. Glutamate is the most common neurotransmitter in the brain. 75% of neurotransmission glutamate is responsible for. But when you get excessive amounts of glutamate, because it's what we call an excitatory neurotransmitter, too much NutraSweet, too much stress, too much nicotine, too much caffeine, all increase glutamate and are toxic, can be very harmful. Okay? So we need to keep, you got to have enough or you won't be awake, but too much is clearly a problem. And then we need to enhance another neurotransmitter that's heavily involved with memory called acetylcholine. So, who's at risk? There's a genetic risk. If you have Alzheimer's disease or other forms of dementia or Parkinson's disease in your family, you are at risk. I think everybody should know their ApoE genotype. It's called the apolipoprotein E. Now, the genotype, you can get E2, which is mine, thank God, E3, or E4. And if you have one of the E4s, you're at 2.5 times the risk for Alzheimer's disease. If you're at 2, you're at 5 times the risk for Alzheimer's disease. Now, why should you know what your genotype is and your doctor can order it? And it's done, it's a lab test, it's a blood test. You should know because you should know your risk. Not to get you feeling bad about it, but if you're at risk, you need to take this stuff serious today. I think if children are at risk, they should not be allowed to play contact sports. I can't be any clearer than that. If you're at risk, because we know if you have the gene and you have a significant brain injury, you are now 10 times the risk for Alzheimer's disease. And so, golf is good. Tennis, terrific. Table tennis, the world's best sport. Now, most of you don't know, but I play table tennis at a very high level. I used to play in the United States Army team. And in 1999, I played in the U.S. Nationals. And I was playing this match, and I went and I hit the ball really hard, and then, what? But most people don't play at that level. Okay. Brain injury increases your risk. There's a condition called dementia pugilistica, which is the dementia that boxers get. Boxers who have the E4 genotype start showing cognitive impairment after their 11th fight. Boxers who don't have the gene don't show cognitive impairment until after their 30th fight. So if you have cognitive impairment after your 11th fight, you're going to make stupid decisions in the ring that get you hurt even more. And did anybody besides me see the study recently on tackle football, where they put sensors in high school football players' helmets? And what they found was in a typical football game, these kids, these children, are getting hit in the head 30 to 50 times. Some of them with the force of a severe car accident. And we don't think anything of it. You have a concussion? Come on, be a man. Get back in the game. That's the mindset. Why? Because they're being coached by people who have brain damage. I mean, they're not thinking about it. I played football in high school. I had coaches, and oh my God, I wish I could scan them. These were not nice people. Alcohol abuse is clearly toxic for your brain. I mean, if you have a glass or two of wine a week, it's probably fine. You're having a glass or two every single night, that's not fine. you're going to see your brain prematurely age over time. And I don't know about you, but I want the best brain I can get. I mean, this is important to me because it helps me be me. Cardiovascular disease, hypertension, cholesterol, having a heart attack, having heart arrhythmias increase your risk. Having blood vessel disease in your brain, strokes. You exercise less than twice a week. If you didn't go that far in school. There's some of us that think that Alzheimer's disease actually starts very early. It's why we should be taking kids who have ADD and learning disability and be very serious and aggressive in treating them. And when we look at them on scans, some of them have decreased activity in the parietal lobes, decreased activity in their medial temporal lobes. And one of the things I found is that Aricept, one of the medicines that boosts acetylcholine, often helps kids who have memory and learning problems. Diabetes increases your risk, which is why it's very important if you have it, get it treated. That's what Dr. Schenkel would say. He says if you have these conditions, just make sure you take care of them. Get them tuned up as much as possible. Smoking increases your risk. The early studies actually said smoking decreased your risk. Until what they found is the people who are at risk, they died early. So when they looked at the older people, they didn't smoke because the other ones, the smokers, were dead. Parkinson's disease, untreated depression doubles your risk for Alzheimer's disease. Untreated ADD, both Dr. Schenkel and I believe it increases the risk. We just see a lot of untreated ADD in our dementia population. Low estrogen. If you have a hysterectomy and you are put into menopause and you don't take hormone replacement, you're at 3 to 5 times the risk to develop Alzheimer's disease. Now, I know there's lots of controversy about taking hormones or not taking hormones, and you have to sort of figure it out with your doctor. Our position in the book was, if you are at risk for Alzheimer's disease, you probably should take hormone replacement unless there is a reason not to, unless there's a family history of uterine cancer or family history of breast cancer. But even now, there's some new medications, Evista is one of them, that target, in a good way, your heart and your brain, but they spare your breast and your uterus. So, you know, the controversy that got millions and millions of women to stop their Premarin was around one preparation of estrogen and progesterone, not around all of them. Probably the natural form of estrogen is safe and helpful. Studies at UCLA using brain SPECT in menopause, as you go through menopause, many women, their brain becomes significantly less active. It's probably a bad thing. Low testosterone. So we talk about menopause. We also should talk about andropause. As androgens go low, there's some new studies that indicate that's a risk factor for Alzheimer's disease. So if you're tired and you have no libido, your memory's not that good, somebody should check your testosterone level. Sleep apnea. Very common sleeping illness. Sleep apnea where you snore loudly. You stop breathing multiple times at night. You're tired during the day. Doubles your risk for Alzheimer's disease. That's why it's important to get treated, because what we see is very severe decreased activity in the parietal lobes in many of our sleep apnea people. Cancer treatment. Now it's like, come on, Dr. Amen, you got to treat the cancer or you never make it that long. That's true, but cancer, as it kills cancer cells, kills healthy cells too, and many people get cognitively impaired, which means that's why you, with cognitive impairment, go after all these prevention and treatment strategies that I'm going to talk about shortly. There's a chemical that we can measure in your blood called homocysteine. High homocysteine levels are associated with heart disease, with strokes, and now we know they're associated with Alzheimer's disease. It's basically due to a deficiency in B vitamins. Take a good B vitamin every day, 100% B vitamin. Oh, Dr. Amen, I don't need to take vitamins. I have a balanced diet. Nobody I know has a balanced diet, right? We are literally a fast food nation. I think everybody should be taking a really good 100% multiple vitamin every day. You want to read a book that will make you sick? Read Fast Food Nation. It's a wonderful book, but you won't eat at many fast food restaurants after you read it. All right, you want to prevent it? Well, know and change your risk. Know your ApoE status early, maybe in childhood. Exercise. I can't tell you. I can't say it more importantly. Exercise. Get your heart rate up on a regular basis. You got to exercise your brain. And you can't just do the same thing. I'll just give you the example of what I do. I read brain scans. And I probably read 300 or 400 of them a month. And what used to take me an hour and a half to read, because I was like figuring everything out and looking at, because we look at slices and then we look at the 3D pictures. And, by 1995 it took me 45 minutes to read. By 1999 it took me 20 minutes to read. And now I can look at one and it's sort of like a snapshot thing in my head. I mean, it's like this is too hot and this is too cold, and it's probably what you should do about it. So if I spent all of my time doing something that is technical and complicated, but how I already know how to do it, it is of no challenge to my brain. If I want to keep my brain healthy, I have to do new things. I have to do different things. And it might be learning a language, or learning something in business that's involved with management, or learning to paint. You have to keep your brain on new and different things. Because as you learn something new, your brain makes a new connection. When you stop learning, your brain actually starts to disconnect itself. Do not give everything to your children as much as we love our children. Because people who don't have to work for things, their brains don't make those connections. It's a wonderful study by Donald Hebb. They're called Hebb's rats. He would raise rats in a laboratory. And then he took a group of them and raised them in his kitchen, much to the dismay of Mrs. Hebb. And they had cats. And he looked at their brains after they developed. The rats raised, where they were given everything, versus the rats that were raised having to, solve problems, had to stay away from the cats, had to stay away from the broom. And what he found is there were many more dense neuronal connections in the rats that were challenged. So if you just go to work at a job that bores you, that you know how to do, and you come home and you spend the evening with a beer watching ESPN, it's not good for your brain. You got to keep learning. Which is why it's so important to deal with kids who have learning disabilities. Because over time, they hate learning because they're not good at it. And when they finish high school, if they ever do, 35% of untreated ADD kids never finish high school. They're done. I mean, they just don't want to do it anymore. And that's really very bad for their brain. Low-dose ibuprofen or an aspirin, because they reduce beta-amyloid plaque formation. I hate this one. I just have to tell you, I hate this one. Eat less. People who eat less than other people live 30% longer. Eat less. This massive increase in childhood obesity is going to be killing these children's brains. We get so upset. We put a child on a stimulant medication because they have ADD, and they stop eating. And parents are so upset, and it's back off. People who eat less live longer. Do you know you get all the fat cells you'll ever have by the time you're 16? After that, they get bigger and they get smaller, but you have all the ones you have by the time you're 16. If you make it to 16 and you have fewer fat cells, it's probably a good thing, because our fat cells harbor a lot of toxic materials. So I think it's very important to take this childhood obesity syndrome seriously, because it's going to affect them later in their lives. Supplement your diet with omega-3 fatty acids. I mean, I know many people eat salmon, and it's great. Although there are some studies that people who eat a lot of fish have more mercury in their systems, which is toxic. I have to tell you, I take 2 every day, Nordic Naturals Pro Omega. I have no stock in this company. but it's high quality, molecularly distilled fish oil that is a nice balance of omega-3 fatty acids. 60% of the solid weight of your brain is fat, and all of your neurons are lined in things called essential fatty acids. Boosting omega-3 fatty acids is helpful because we found omega-3s are low in ADD, they're low in depression, they're low in dementia. And so, I can't think of a good reason. Now, it's different. Get pharmaceutical grade, high quality, because the kind of fish oil you get at Costco is distilled to 1 in 10,000 particles. The pharmaceutical grade is distilled to 1 in 3 billion particles. And that's what you want. Really high quality stuff, because it's your brain we're dealing with. The one I like is Nordic Naturals Pro Omega. A very nice blend of different kinds of omega-3 fatty acids. Now, some people are vegetarians. They're going, well, what can I do? Well, flaxseed oil. The problem is you have to take 30 times the flaxseed oil to get the same level as you do in fish oil. Now, it'll keep you regular if you're taking that much. The next thing is vitamin E and vitamin C. And take them together. And brand new study, people who take vitamin E and vitamin C in vitamin form have a 78% less chance of getting Alzheimer's disease. I'm there. 400 international units of vitamin E twice a day. And find the kind that is what we call mixed tocopherols, have both alpha and gamma tocopherols in them. 400 international units twice a day. And vitamin C, 1,000 milligrams twice a day. If you don't need it, you'll pee it out. But they help to prevent. What vitamin C actually doesn't get into the brain, but it helps vitamin E get into the brain. It's a super antioxidant. Take a B complex, 100%, especially folic acid. 400 micrograms of folic acid a day. Because you want to lower your homocysteine level, and the B vitamins tend to do that. And if you drink, in the book we talk about the research with alcohol, and it's basically less than weekly drinking. Once or twice is probably okay. Much more than that, it's a problem. Ginkgo. There's actually some very nice research with ginkgo biloba. What ginkgo does is increase blood supply to the brain. It increases blood flow to the brain. So 60 to 120 milligrams twice a day. I've done before and after scans on ginkgo, and I went, whoa, this is very nice. Phosphatidylserine. There are 18 studies with phosphatidylserine. 100 milligrams 3 times a day. Estrogen, if it's appropriate. And a very cool supplement called alpha-lipoic acid. 200 to 300 milligrams twice a day, because it helps to get rid of toxic metals. Now, if you believe my mother, she'll say you should not use deodorant that has aluminum in it. And I have to tell you, my mother's got the world's best brain. So I pay attention to what this woman says. So try to not have aluminum in your deodorant. But taking alpha-lipoic acid, it's a super antioxidant. Plus, they use it as a chelator to get rid of the heavy metals in your body. Also, especially if you have Parkinson's disease in your family, coenzyme Q10, 200 to 600 milligrams twice a day. So those are the things that you can do to prevent Alzheimer's disease. Ways to keep your brain healthy as you age. This comes from Gary Larson. It's called brain aerobics. Right side, 1, 2, 1, 2, 1, 2. Left side, 1, 2, 1, 2. Okay, come on, keep those cerebellums up. 1, 2, 1, 2. If you exercise on a regular basis, after age 70, your memory and other cognitive abilities are less likely to be impaired. Your cell's ability to repair DNA is better. Blood flow to your brain is better. Why is that important? It's blood brings nutrients, oxygen and sugar to your brain so it can work properly, and it gets rid of toxic substances. Your brain is protected against molecules that overexcite it, like free radicals, or high sugar levels, or high glutamate levels. Why do I like high protein, low carbohydrate diets? Because you get rid of all that sugar that they're finding is toxic to brain function. Now, if you have a little bit of sugar, it's like not a bad thing, but there are people they're sugarholics. I mean, if you look at what they have for breakfast, what they have for lunch, it's filled with sugar. I had a nice conversation at lunch today about bread. Well, go to the grocery store and look at the ingredients on bread. And what you're going to see is corn syrup. What is corn syrup doing in bread? And you're going to see fructose in bread. You're going to see all sorts of simple sugar carbohydrates in bread. As far as I know, there's only one kind that has virtually no sugar, and it's Oro-wheat Russian rye bread. It's actually pretty good. Right? And if you have to have sugar, say, oh, I have to have toast and jam in the morning. Well, you can get the Russian rye, which is really pretty good, and then get Smucker's spreadable fruit. Why do they need to put sugar in jam? It's already supposed to be sweet. And they do it, in large part, some cynical people think, to get you hooked on it. You get hooked on sugar, you bet you do. All right, I hate to sound preachy, I really do, but you know, with my last name, I can do it. I was going to be a priest, but Father, amen. I just thought nobody would have believed it. Exercise increases how your brain metabolizes cholesterol. It improves insulin regulation. It increases your response to stress, especially in the hippocampus. Hippocampus is one of the major memory centers in the brain. And the tone of your blood vessels is improved because nitric oxide, the chemical, is enhanced. And what nitric oxide does is take your blood vessels, which are supposed to be round, and keeps them round. As you age, they get floppy. You know how sort of your body begins to flop a little bit? Well, so do your blood vessels begin to flop. It's a very bad thing. Exercise helps that. Well, what if you got it? What if you have early Alzheimer's disease? Well, one, you want to work up for other causes of memory problems. Depression, low thyroid, a certain kind of, it's called normal pressure, hydrocephalus in your brain. Some sort of anemias can cause it, like B12 anemias. So you have to get a good medical workup. And then you do the prevention strategies that we just talked about. Most of them. And then you start with agents that increase acetylcholine to the brain. We have some actually pretty good ones. Aricept, Exelon, and Remenil. Aricept's sort of the standard. It's used a lot. It's one of the oldest ones. Exelon may be a little bit better for Alzheimer's disease because it goes after two different enzyme systems that are involved in making beta amyloid plaques. Remenil may actually be better for frontal temporal lobe dementia because it works on the nicotine receptors. It's a little on the stimulating side. In fact, for some of those people, we'll actually give them some nicotine patches because it will boost them up a little bit. Sometimes we'll also use Ritalin or Dexedrine. You know, now we'll use the better preparations, Concerta or Adderall for them. And then the new medicine, which is very exciting. It's called Namenda. Memantine is the generic name. It was just approved, just released by Forest Labs. It's been used in Europe for the last 10 years. And it modulates glutamate. So remember, we talked about if glutamate is like overactive, that's toxic for cells. If it's underactive, you're sleepy. So modulates means it raises it if it's low, but puts a lid on it so it won't go too high. And it's very exciting. This is one of my patients. Actually, he had a brain infection when he was 3 years old. And it killed his cerebellum, back bottom part of the brain. You'll actually notice it's missing. But in addition, he had low activity in his temporal lobe and low activity in the front part of his brain. On Namenda, or memantine, he got overall better activity. That was very exciting because he could concentrate better. His social skills were better. In addition, if we look at the hot areas in his brain, the image on the left, he has increased activity in a part of the brain called the cingulate gyrus, the top middle part of the brain, that caused him to get stuck on things, to worry about things, to hold on to things. And on Namenda, it actually calmed that down. So in a way, it helped to balance his brain function. So it's a new medicine that they're finding will work late in Alzheimer's disease. Now, because it modulates glutamate, I have this sneaky suspicion, borne out by a brand new study from Johns Hopkins University, that our children who have the ring of fire, this excessive overall increased activity, have excessive amounts of glutamate in their brain. And Namenda might actually be something to settle it down without crashing it. So just something to put in the back of your head and think about. If nothing you do works, maybe it would be worth it, because it seems to be a very nice, not very toxic medication. Well, what's on the horizon? Future treatments. This is from that same night. All these sunsets were from one night on my balcony. Genetic testing. I mean, I think we should start using it now, especially the apolipoprotein. E-gene. Brain imaging, routine in clinical practice. I mean, there's actually a company that based brain SPECT imaging, and they're starting to open up clinics around the country besides us. I mean, it's pretty exciting. People are seeing this. Their main advisor on their advisory board is the chairman of psychiatry at the University of Colorado. And so we're going to see this as routine. We just have a 20,000 scan head start. Treatments like transcranial magnetic stimulation, where we can put powerful magnets and increase blood supply. Or another very exciting one that I'm getting very excited about, it's called hyperbaric oxygen treatment. Put people in hyperbaric chambers, force increased levels of oxygen into the bloodstream. And I have to tell you, I have 10 before and after scans on my computer. It is so cool how it increases what looks like healthy blood supply to the brain. Nerve growth factors. We're actually injecting people with nerve growth factors. There are vaccines. Now, the first vaccine with Alzheimer's disease worked in rats, worked in some humans, but made other humans sick. But that's the first try. I mean, in the next 10 years, we're going to have vaccines against producing beta amyloid plaques. That's pretty exciting. There's also stem cell research going on. And at Stanford, they're using low-flow shunts, where they're putting shunts in people's ventricles to decrease the pressure, but more than that, to drain off what they think of as toxic chemicals that are floating around in your cerebral spinal fluid. And they're finding significant benefits to it, that people are getting worse slower than if you do nothing. And one of the most exciting treatments that I've been involved with is something called omental transposition surgery. What the heck is that? Well, the omentum is a large fatty apron that hangs in your belly. It hangs over your intestines. And there was a surgeon, a general surgeon, by the name of Harry Goldsmith, in the 60s at Sloan Kettering, that he was dealing with women who had breast cancer surgeries, and they were getting problems with wound healing because they used to take all of the lymph nodes out of your armpit. And what they would do is they'd damage that area, and then the arms would swell up. And so he wanted to do something to try and heal that. And he said, well, what has a lot of blood vessels in it? Is there something I can transpose, take from another place and put it here? And he thought about the omentum. Because the omentum is filled with blood vessels along with nerve cell growth factors and something called angiogenic or blood vessel growth factors. So he started taking it and folding it over into their armpit. And he got significant wound healing with it. Well, how cool is that? And he goes, well, what other conditions is there low blood flow to that I can help? And then in the early 90s, he started thinking about people with strokes. And so he did this omental transposition surgery where he would take the omentum from the gut, take it out and stretch it, tunnel it underneath your chest and your neck, and plop it onto the brain. And people started to get better. And just a couple of years ago, they started doing it with Alzheimer's patients. So they take the omentum from the gut, stretch it. So that means they're keeping it attached to its blood supply, tunneling it underneath the neck, putting it onto the brain. It's really wild. So this is an example where you can see the omentum at surgery being stretched. Open the skull. Remember, your brain is very soft. You bet it's soft. Putting it on, and then closing them up. And this is one of our patients. My role in the study, I was involved in the study. I got to take the pictures. I did the before and after scans. And so this is Stella, who they were ready to put in a long-term care facility because they couldn't manage her at home. And you see the images on the left are before surgery. The images on the right are after surgery. Now, Alzheimer's disease, frontal temporal lobe dementias, are progressive, deteriorating diseases. We would have been happy if we just stopped it. We actually got improvement. As far as I know, this is one of the only treatments that show not just stopping it, but getting it better. This is Jimmy. Jimmy was a Shakespearean actor, and his big complaint is he couldn't do Shakespeare anymore. And if you look at the speech area of his brain, which is the left prefrontal cortex, see how damaged it is before the surgery, how much better it is after the surgery. Now, we really don't think this is going to be like the long-term treatment, but we're learning a lot. What does the omentum have that is healing? And what can we make artificially that we can put on the brain or inject into your arm or give you a pill for that increases blood vessel angiogenic growth factor or stem cell growth factor? Keep your brain healthy so your kids don't have to suffer with you. I took care of a father-in-law for a long time who had dementia. This was alcohol-induced. It's not easy. It's great stress. And you know about the sandwich generation because many of us are part of it. We're dealing with kids who have issues and we're dealing with older people. If you love your children, I'm dead serious when I say this, you have to take care of your own brain so they don't have to take care of it. Do you know how hard it is to take a parent's driver's license from them? It's not easy. It's very hard. To take their keys, it's hard. To put them in a home, it's really hard. I don't want that for my kids. Okay, so make your sunset as beautiful as possible. Low doses of ibuprofen is what you want. 100 milligrams a day. 100 or 200 milligrams a day would be a low dose. You're at more risk for side effects if you take higher doses. I mean, I know if I throw out my shoulder, I'm going to take 1,600 milligrams. And, I'm going to pray for my kidneys that, they're like going to be okay. But it's not something to do on a regular basis. I think if you have it all of your life, you may have a learning disability. Where you would get really concerned is if there's a change. Now, I think if you have it all your life, you just get it evaluated because with all these new things that we have, maybe it doesn't have to be the joke in your family. Right? I mean, maybe things can be better. But if you notice that there's a change, there's a whole bunch of reasons why that could change, and you want to figure that out and go after them. I think the research is better. You should be taking flax seeds rather than oil. I think that's what people would say. You bet. We scan lots of people with PTSD. It's really one of our interests. And chronic exposure to stress hormones kill cells in the hippocampus. So we frequently see significant decreased activity in the insides of the temporal lobe. So that means, 1, treat the trauma. 2, help them with stress management techniques. And 3, go after ways to increase it. And there are lots of ways to do it. And a lot of these things I showed you were not terribly expensive ways of doing it. Let cell phones go. There's not enough radiation to do anything except maybe kill some of the cancer cells. There's just no evidence itself. And I have to tell you, I mean, if cell phones were doing it, I get 2,000 minutes a month. I'd have been dead 10 years ago. Question is about statins. Statins are medications that lower cholesterol. And what they found, there's some evidence, although there's some studies that say yes and there's some studies that say no, there's some evidence that it may actually lower your risk for Alzheimer's disease. High cholesterol is clearly a problem. It's clearly a problem. It's going to kill you. Low cholesterol, under 100, it's clearly a problem. You may kill somebody else. There's 5 studies now implicating low cholesterols under 100 with depression, suicide, and homicide. So you need to have a balance of cholesterol. Yes, we just recently finished a meditation study. I took it out because I didn't know if I'd have time for it. But what we did, we did this with UC San Diego. We took 11 meditators. 10 of them were experienced Sikh meditators. And they did a form of meditation called Kriya Kirtan. And in this, what they did for 12 minutes was do sa, ta, na, ma. And they did 2 minutes out loud, 2 minutes whispering, 4 minutes silently to themselves, 2 minutes whispering, 2 minutes out loud, and then we injected them with imaging solution. What we found is that with meditation, significantly decrease the activity in your left temporal lobe. That's the part of your brain that orients you in time and space. Significantly increased frontal lobe activity. I mean, it's a focus kind of meditation. The thing that sort of blew us away was your right lateral temporal lobe fired it up, which there's some evidence that that's the God spot in the brain. Some neuroscientists, we call these people neurotheologists, have done studies when they stimulate the outside of the right temporal lobe, people have more religious or spiritual experiences. And growing up Catholic, I went to a Christian college and a Christian medical school, so I like to think about this stuff. So some people would go, well, that means God is made up in the brain. And if you have a small right temporal lobe, you could think that way. I think if God's going to communicate with you, there's got to be a way to do that. And that we can train that area through using biofeedback techniques. We can put electrodes over here and actually stimulate it to work harder, and it might actually help people with their sense of spiritual experience. It's pretty interesting. But if you go to church, there's great music at church. At least the churches I like, great music. Well, music and rhythm fire up especially the right temporal lobe, which is why I think churches use music to help people get into more spiritual states. Now, some music does not help this. I was involved with a study where we looked at, Brianne and I did this together. Do you remember this study? We looked at classical music, Mozart. This is my daughter Brianne in the back who's filming for us. We looked at Mozart, we looked at heavy metal, country, rock, and rap. And she had kids her age playing the game memory under each state. And she'd time them. And the kids who listened to Mozart did the best, by far. The kids who listened to country did the second best. Rock and roll was third, and with rap, Some of the kids never finished the game. One little boy, she said, not little boy, high school boy, was so excited by the music that the card and throw him up in the air. So the music you listen to matters. All the prevention strategies that we talked about. I mean, if you have your hormone levels balanced properly, and for women, they also need to look at testosterone, because women with low testosterone levels, lower than normal for them, they're tired and have no energy and no libido, which is, I think, a bad thing, because we talked about this on television today. That having sex with a partner. Women who have regular sex with a committed partner have more regular periods, more fertile periods, better memories, and better moods. So, sex is good. Connection is good. Yeah, there's actually, I think as early as you can get it, the better. A study that got a lot of media attention was that people who had Alzheimer's disease, if they got hormone replacement, it didn't help them. And it's like, well, no kidding. If you burn out the circuits, you can pass more electricity, but it won't go anywhere. But that got a lot of media play that said hormones don't work. And I'm like going, well, of course they won't work then. You have to get it as early as possible. It's like the acetylcholinesterase inhibitors. If you get it early, they tend to be very effective. If you don't get it till later in the illness, it tends not to work.